Good day everyone, my name is Dr. Marasigan Reyes, a general and laparoscopic surgeon. Welcome to my YouTube channel, Marasigan Reyes. Our topic for today's episode is about the comparison between the Spanish flu pandemic of 1918 and the current pandemic. I hope that we could learn something so that we can apply it to the present situation, so that in our own little way we can help end this pandemic. There are some similarities in the two pandemic, being the second and the third deadliest pandemic in the world history. The first being the bubonic plague in the 30th century, which killed approximately 75 to 200 million people around the globe. So now let's start comparing the two pandemics, the Spanish flu and the COVID-19 pandemic. This is just for education and additional information purposes only. So when did the Spanish flu happen? It happened in 1918 to 1919, and the COVID-19 pandemic started December of 2019 up to the present. And the country of origin, it is unsure, because during the time there was World War I, and the countries from where this pandemic started were hiding the information, and Spain is the only country who first reported the cases of Spanish flu. So the pandemic could have started in France, China, and Britain, and only Spain reported, because they were not involved, or they were neutral during World War I. While the COVID-19 pandemic started at Wuhan, Hubei province, China, and the causative agent for the Spanish flu, it is type A influenza type A virus, subtype H1N1 of avian origin. So it's zoonotic, coming from an animal. While the COVID-19, the causative agent is SARS-CoV-2, belonging to the family of Coronaviridae, single-stranded RNA virus. For the mode of transmission, both of them from respiratory droplets. So inhalation of the respiratory droplets, or contamination of the mucous membrane, the eyes, nose, and mouth of respiratory droplets, whether from touching the eyes, the mouth, or the nose, or any mucous membrane in that area. For the number of infected individual, or number of infected people, for the Spanish flu, it's around 500 million globally, and for the COVID-19, it is more than 372 million people and counting. As of the recording of this video, the average number of new cases is around 3 million per day, additional new cases. For the deaths, number of deaths for the Spanish flu is around 50 million. There are different estimates, some 20, some 30, but others around 50 million. And for COVID-19, it's 5.6 million, more than 5.6 million as of the recording of this video. With regards to the duration of the pandemic, the Spanish flu lasted for 18 months in 1918 to 1919, while the COVID-19 started December 2019 and it was declared a pandemic on March 2020 up to the present. For the clinical presentation, for the Spanish flu, we have fever, dry cough, headache, and body aches, sore throat, chills, runny nose, loss of appetite, extreme tiredness, and difficulty of breathing, and cyanosis for severe cases. While for COVID-19, the symptoms, the signs and symptoms are almost the same. So we have fever and chills, dry cough, shortness of breath or difficulty of breathing for moderate to severe cases, fatigue, muscle and body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea and vomiting, and diarrhea. For the treatment for the Spanish flu, there were none actually. There's no specific treatment during the time. The treatment was only supportive, controlling fever, and sometimes they give a limited oxygen therapy, because during that time they were not sure exactly what they are dealing with, a virus or a bacteria. That they are not yet sure, and only after 10 years they discovered what caused the pandemic. And during the time, there were no antivirals and no antibiotics to treat secondary bacterial infection. While for COVID-19, we have antivirals, and the first that was used was the remdesivir, and they also used the molnupiravir, and right now we have the Paxlovid from Pfizer. It is nirmatrelvir, ritonavir combination, and there is a wide use of ventilatory support and other supportive measures. And the advantage during this time is they know exactly what is the causative organism or the causative virus of the COVID-19 pandemic. Part of the management of the current pandemic is the use of antibiotics to treat the secondary bacterial infections that set in, especially bacterial pneumonia. For vaccine, there was none for Spanish flu. Way back then, they didn't even know what was the causative agent. While for the COVID-19, we have vaccines made by Pfizer, Moderna, Sinovac, Sinopharm, Sputnik, and Johnson & Johnson. So what are the public health measures that were implemented in the two pandemics? So for the Spanish flu, there were early isolation and preventive measures. There were closure of schools, churches, and non-essential businesses, and mass gathering was banned with mandatory wearing of face masks. There were also quarantine and hand hygiene. For the COVID-19 pandemic, there is also mandatory wearing of face masks. And for healthcare workers in the hospital and healthcare facilities, aside from the face masks, they were obliged to wear face shield or eye protector. And for the community level, face mask is mandatory. There's also physical or social distancing, hand hygiene, and there's a requirement of good ventilation, and there's also mass vaccination. For the mortality or the case fatality rate for the Spanish flu, it was reported to be 1 to 3%, and there were different reports, but many reports were estimated to be 1 to 3% mortality rate. While for the COVID-19, we cannot say exactly right now because the pandemic is still ongoing. These are just some of the comparison between the Spanish flu and the COVID-19 pandemic. If you know other comparison that was not mentioned, you can comment it in our comment section. I hope that with the knowledge that you've got in this short lecture, you can use it and apply it to the present situation so that we can help in our own little way. We can help end this pandemic. Let us use the advantage we have right now compared to the Spanish flu. Right now, we know the causative agent, we have good diagnostics, we have antiviral drugs, we have vaccines, and we have advanced healthcare and hygiene compared to the Spanish flu period. And also, we know that the portal of entry of the infection with SARS-CoV-2 is through our eyes, nose, and mouth. So aside from the health protocols being implemented, we must protect all the three portals of entry so that we will not get the infection or reinfection. Thank you very much for your kind attention. If you are not yet a subscriber of this channel, I invite you to subscribe to my channel so that you will be updated in my next video. Please also like and share to as many people as possible. I have several video discussions regarding eye protection in addition to the health protocols and wearing of face masks. It is my advocacy to remind everyone that our eyes are also a portal of entry for the SARS-CoV-2, the causative agent of COVID-19. So let us protect our eyes by wearing eye protectors such as goggles or face shield when going to the areas of possible transmission in the community and in the public places. Let's help end the pandemic. Thank you very much. God bless. Keep safe always, everyone.